My name is Sylvia Cheater and I'm President of the Institute of Health Promotion and Education. It's my pleasure today to introduce our first ever online webinar. The title and theme today is Promoting Mental Health and Wellbeing, Current Evidence and Practice. And I'm joined by Dave Cutter, who will be running the webinar and introducing our guest speakers. They are Claire Robson from Public Health England, Sean Russell from West Midlands Combined Authority, and Diane Phimister from Coventry University. This vital topic is timely, and we have recently seen Mental Health Week raise awareness of the issues with lots of media coverage. Mental health and preventing mental ill health is one of the biggest public health challenges we face on a national and international level. And our range of speakers today demonstrates that mental health affects us all: parents, carers and children, young people, older people, and of course in the workplace. And also, the impact on mental health of the broader social determinants of health should not be underestimated. Factors such as employment, housing and finance all have a role to play. And how we can influence mental health through community action is key. Just before I hand over to Dave, I'd like to say a few words about the Institute. It was founded nearly 60 years ago and has been at the forefront of developments in health education and promotion during that time. We have members from a wide range of professional groups, including public health, health promotion specialists, clinicians, education, psychologists, and that's just to name a few. It is a recognised professional association offering full or associate membership to people who are engaged in the practice of health promotion and health education. We publish a peer-reviewed journal, the International Journal of Health Promotion and Education, which has 6 issues a year. Our members receive hard copies and have electronic access and lots of other benefits. Being a member gives you an opportunity to be part of a collective voice in the field of prevention and promotion of health. I'd now like to hand over to Dave Cutter, who will introduce our first guest speaker.
Thanks, Sylvia. First up, we have Claire Robson. Claire is an experienced public health programme manager working in Public Health England's National Life Course team, leading on improving public health outcomes for children, young people and families. Her experience spans local health improvement delivery, national and regional programme management, policy development and organisational design gained from working in a variety of roles across the NHS, the private sector and in regional and national government. Claire's current role includes a focus on improving public mental health outcomes of children and young people. So, good afternoon, Claire, and thanks for joining us. If you can give us any further insight into the work you're carrying out at the moment, and I look forward to your presentation.
Okay, hello, my name's Claire Robson. I'm Programme Manager at Public Health England. I work in the Life Course and Health Inequalities team, and I lead around improving public health outcomes for the school-age population. This presentation will look at promoting children and young people's mental health and wellbeing, an evidence-informed approach. This slide just provides an overview of what I'll be talking about. I'll first of all look at some of the latest statistics on children and young people's mental health. I'll then move on to look at what influences children and young people's mental health. And I'll be looking at some of the wider psychosocial determinants, some of the statistically significant factors in the data, and also what children and young people themselves say is important. And then finally, I'll move on to looking at what are the implications for understanding evidence of what works to improve mental health and wellbeing of children and young people. And I'll be looking at that in terms of findings from the literature, findings from practice, and the views of children and young people. So first of all, looking then at the data. We know that 50% of all mental disorders emerge before the age of 14, and that 75% of all mental disorders emerge before the age of 25. So the period of being a child and a young person is really significant in terms of opportunities for intervening early to improve outcomes for children's mental health. The latest prevalence statistics for the mental health of children and young people in England, which were published last November, highlight that 1 in 8 5 to 19-year-olds have at least one mental disorder. and that the prevalence of mental disorders increases with age. We know that 5.5% of 2 to 4-year-old children experience mental disorders compared to 16.9% of 17 to 19-year-olds. There has been a slight increase over time in the prevalence of mental disorders in 5 to 15-year-olds. But when we group these according to whether they are emotional disorders, behavioural, hyperactivity, or other less common disorders, what we're seeing is that emotional disorders have become more common, whereas all other types of disorders have remained similar in prevalence for 5 to 15-year-olds. This next slide just shows the range of interviews and methodologies that were used to get the data. So you can see summarised across the life course here, the methods included parent interviews, teacher interviews, child self-reporting, and young person self-reporting. Just to touch on some of the other findings, rates of mental disorder were quite significantly higher in older age groups. So young people aged 17 to 19 were 3 times more likely to have a disorder than preschool children. And then when we look at factors like self-esteem and mental well-being, we can see gender differences between boys and girls. So boys report higher levels of both self-esteem and mental well-being in comparison to girls. The survey also touched on some wider behaviour, social, lifestyle and identity contextual information. And we see that for young people who have a mental disorder, they are more likely than those without to have spent longer, in other words, 4 hours or more on social media compared themselves to others when online, and felt that the number of likes they got affect their mood. They're also more likely to have been bullied and to bully others. They have also experienced some types of adverse life events, and they're more likely to have lower levels of social support and a smaller social network. They're more likely to have self-harmed or attempted suicide in the past 4 weeks and at some point in their life. And they're less likely to participate in clubs or organisations, more likely to have tried alcohol, illicit drugs, tobacco and e-cigarettes, and not to identify as heterosexual. So moving on from the data to look at some of the influences on children and young people's mental health and well-being, and trying to understand a bit more about these. The psychosocial pathways is a useful model for trying to conceptualize this. So we know that at a national, political, social, economic, environmental level, there are factors which shape the social stratification across a number of dimensions, such as education, occupation, income and wealth, area of residence, age, disability, ethnicity, and gender identity. And that this in turn leads to groups experiencing differential exposures and vulnerabilities to the social determinants of health, including, for example, conditions in childhood, education, employment, housing, the quality of the neighbourhood in which you live, both built and social environment. The effect that these have on mental and physical health is mediated by psychosocial factors, health-related behaviour, biological and genetic factors. So each part of these is a dynamic, interactive set of relationships. So it just summarises really the complexity of factors, both protective and risk factors that influence our mental health and well-being. The Centre for Longitudinal Studies has analysed a cohort of children born in the year 2000, and at the age of 11, they have looked at some of the relationships in the data around factors that influence mental illness on the one hand and mental well-being on the other. And this diagram highlights some of the statistically significant factors that were found through the data analysis. It shows how the factors span both individual, family, school and neighbourhood, and wider socio-economic circumstances. And it also shows the differences between factors that are linked more to mental illness and those linked to well-being, and then the common ground in the centre, where some factors influence both. And then another slide that I wanted to share with you that is illustrative of the complexity of this situation is what children and young people themselves perceive to be factors that influence their mental health. So this is the output from a process of bringing a group of young people together and asking them to map the factors that they perceive influence their mental health and well-being. And what's interesting about this is that from their perspective, you can see shaded in sort of dark pink red are many factors that link with self and identity. And then some of the other factors, so shaded in blue, factors that concern relationships, factors in yellow highlight those linked to the educational context of their lives, green, some of the wider societal factors, and then sort of light pink factors linked to their family context. It's also really helpful, this process, in highlighting factors that maybe an adult going through a similar exercise may not have picked up on or expressed some of the factors. So there are things that are quite bespoke to children's lives, perhaps pets, animals, and then the importance of leisure and recreational music, factors like that that influence significantly children's mental health and their perceptions of what keeps them mentally well. So what does all of this mean when we come to try to understand evidence of what works? And from a public health perspective, where we're interested in looking at factors that impact at a population level, it's really important that we take stock of the complexity of the system that I've just explained and some of the complex relationships between the factors, because that has a bearing when we come to understand evidence and when we understand the relationships and where possibly to invest our efforts in seeking to achieve positive outcomes for children and young people. So Harry Rutter has presented some of his thinking on a complex systems model of evidence for public health, and we're finding that this has increasing application in when we're taking a public health approach to this. The notion here is that one single element doesn't work, and in this picture here you see a number of people moving sandbags trying to stop a flood, and the notion being that any one of those sandbags on their own doesn't do the job, and it's the combination of a lot of them together, a lot of different interventions, if you like, that stops the floodgates from bursting. So yeah, major public health problems are the outcomes of multiple interactions within complex systems. And our current approach to understanding evidence is often structurally biased towards short-term, individual level interventions. We try to look at differences between baseline and follow-up, maybe at 12 months, and we try to extrapolate where an outcome is linked back to a specific intervention, whereas there is a multiple factors that influence those outcomes. And this requires much more than a focus just on those individual risk factors. It's important to be able to frame our responses as driving disturbances within systems and not as hammers applied to nails. And I've used here in this illustration that the Health Foundation used, so that the previous slide of the sandbags and this one around the hammer driving applied to nails, those are borrowed from the Health Foundation, with whom we've been working on some of this work. So in summary, we need to find a different way of understanding evidence, and that our mental and physical health needs need to be viewed as an emergent property of the conditions that we find ourselves living within, and not as a linear model of cause and effect. So this may call really for new paradigms of evidence, where you can see here the kind of traditional hierarchy of evidence, randomized control trials and systematic reviews at the top of the pyramid. We may need, when we're looking at population level, to look at perhaps a different way of weighting being given to the range of evidence that we're looking at. So I'm now going to describe how Public Health England and myself in my role within PHE have sought to understand some of the evidence for universal approaches to children's mental health. So in the last year, I set up a special interest group. This came out of a recommendation within the Green Paper, Transforming Children and Young People's Mental Health, which made a recommendation that PHE would set up a special interest group, that it would focus on key prevention evidence and its relevance to practice, and that would then feed into wider prevention work within the system, that we would highlight evidence gaps and make recommendations for these to be addressed through further research. So we took a mixed methods approach to this. We did work with colleagues from the Anna Freud Centre, who undertook on our behalf a synthesis of systematic reviews. So we did look at the academic literature. We also looked at the grey literature, and by that I mean we searched online databases, websites, we did a call for submissions from experts. We were interested from that to understand what people were commissioning in practice around universal approaches to children's mental health. And then we also, in collaboration with the Association of Young People's Health, and through them a wider consortium of voluntary and community sector partners, undertook some work with young people, some focus groups, a mapping workshop that was undertaken by the Prince's Trust and the Health Foundation with young people, and some desk-based review of what we already know that's been published about children and young people's views about their mental health and what keeps them mentally well. We used the framing that I highlighted through the Centre for Longitudinal Studies, and how they presented the statistically significant factors that influence mental health across those 4 domains of individual, family, school and learning environment, and wider community. So we were interested in trying to find evidence at those different levels that impacted on children's mental health. In terms of, first of all, then the academic review and the synthesis of systematic reviews, we looked for 4 outcome categories. These emerged from looking at the literature, that the interventions tended to fall into one of 4 categories, and I've summarised these on this slide: promoting resilience, promoting subjective emotional well-being, preventing behavioural difficulties, and preventing emotional difficulties. Interventions that were identified from the synthesis of systematic reviews were rated for a level of promise, whereby those that had at least 2 studies providing evidence of effectiveness for a given outcome were included in a list of promising interventions, and key characteristics were highlighted. So you can see summarised on this slide the findings from that the synthesis of the systematic reviews. This identified 113 interventions, the majority of which were working at an individual level. Far fewer interventions were found at a family and school level, and no interventions at all were identified to be operating at a community level. The most commonly reported outcome was preventing emotional difficulties, followed by promoting resilience, and then preventing behavioural difficulties. Far fewer studies focused on promoting subjective well-being. There was an absence of information relating to cost effectiveness and return on investment. Of the promising interventions that were identified, and there were 8, 6 focus at the individual level, and you can see summarised in this slide which those were. 2 focus on the family context, and 4 showed evidence of a positive impact at 12 months follow-up. There were some defining characteristics of promising interventions, and we've summarised these on this slide. So for individual interventions, many of these were provided in schools. They were offered in a group setting, often a class. They were offered over a series of weeks, led by professionals, skills-based with strong emphasis on experiential practice in situ, often drew on CBT principles, and often included an element of fun and enjoyable practice. And in terms of interventions working with parents, these were provided online, supported by professional input, and often involved skills-based practice. So just thinking for a moment about the implications of this for research, the fact that there was such variation, both in terms of the outcomes and the methodologies, makes it challenging to evaluate which processes and outcomes within the system drive the change. It's quite difficult to be able to make generalizable statements of impact because it's difficult to replicate interventions in a systematic way which is necessary for empirical measurement. And that's problematic when randomized controlled trials top the hierarchy of evidence. The fact that we, through the synthesis of systematic reviews, didn't identify a single evaluated universal intervention that consistently showed sustained meaningful impacts in improving mental health and well-being doesn't then lead us to conclude that lack of evidence or absence of evidence constitutes evidence of no effect at all. And sometimes we do conflate those conclusions, and it's important to recognise that the methodological challenges in this field are linked with the extent to which we're able to make strong statements around evidence. Failure to capture potential population level benefits of universal interventions, although they may have a small effect size, once you apply that at population level, that can actually represent important mental health gains and associated economic benefits, and we shouldn't overlook that. So just moving on to say a little bit about the findings from the grey literature, this slide summarises the scope of that. Similarly, we found, and apologies, this slide has just slipped off the edge of the slide here, but you can see again the balance between many interventions in practice being focused at an individual level, fewer at a family level, although we did find some operating at that community level as well. And what we have done, and we will shortly be publishing the report from this work, is to cross-reference from both the grey literature review and the synthesis of systematic reviews those interventions that cross-reference to the Early Intervention Foundation's guidebook. And I'll say a little bit more about that at the close, but it's a useful source of information for anyone who's looking at appraising evidence and translating that into practice. So I mentioned that we also consulted with children and young people, and I've just got a few slides before I close that touch on what young people tell us about what helps keep them mentally well. So they were clear through the workshops in saying that people are really important, and sometimes it's very obvious that we perhaps gloss over it, but the importance of family and peers being important in influencing mental well-being. Potentially useful sources of support include school staff, but caution was given because sometimes the roles are a mix. So you may have, for example, someone who manages behaviour also providing support for mental well-being, and sometimes there might be some nervousness on the part of children and young people in wondering, the extent to which information maintains confidentiality. Youth workers, voluntary and community sector often perceived to be really credible sources of genuine support. But young people generally spoke about it might be less about the person and more about their qualities, their capacity to be supportive, friendly, a good listener, non-judgmental, um, being able to have a good understanding themselves of mental health issues, and also continuity and consistency of relationships being really important, and clarity and understanding boundaries and confidentiality are really very high up the list of importance for children and young people. In terms of places to go to that help promote their mental well-being, online spaces, if monitored and moderated, can be safe spaces that help young people feel included. Because for some, that means they avoid the need to have to meet people face to face, which can add to their stress and anxiety if they're experiencing living with mental health problems. Being able to have personal space at home and that not being assumed, young people were really aware of the fact that many young people may not have that in their lives at home, and therefore finding safe social places is important to them. Schools perceived as being potentially safe, but could also contribute to feelings of stress and pressure linked to workload and expectations academically. And then some of the wider influences that children and young people identify as helping to keep them mentally well. I'm not going to go through that list, but you can see some of the themes that were repeated from the mapping workshops as well. So just to summarise then, in terms of gaps in the evidence and recommendations from our work, we did find that there was a lack of family, school, community and wider structural level outcome measures for children and young people's mental health and well-being. In other words, we, because of the way we approach the evidence and the literature, that tends to be dominated by interventions that seek to affect individual level change. But we know from that presentation of the complexity of factors that influence our mental health that many of those are socially constructed, and therefore the need for us to find ways of understanding outcomes at levels beyond the individual. A lack of subjective mental well-being and assets-based measures identified as the primary outcomes for children and young people's mental health. Often the way mental health problems are understood is framed in a kind of negative way rather than understanding the assets measures. So that was also a gap in the evidence. And then there was an absence from our synthesis of the systematic reviews of any cost effectiveness or value for money information, and that increasingly is really important for local commissioners to have at their fingertips. So there's a gap there. And then we've identified these following recommendations that have fallen out of this work. Recommendation 1, to develop an outcomes framework and indicators to guide research, evaluation and practice in relation to children and young people's mental health that includes mental well-being and risk and protective factors that span individuals, family, learning environment, community and structural domains. We think it's important to frame it in that way and not to only focus on, for example, access to services. We need to find ways of balancing across the system, ways of measuring mental well-being as well as mental health problems. Recommendation 2, to investigate the benefits of using complex systems mapping to facilitate whole systems approaches to children and young people's mental health. I touched on how we had used that methodology with children and young people themselves, but actually it has application at a systems level. So within geographical localities, bringing partners together to map the factors that influence children's mental health, to reflect on where current investment is across the system and where there might be gaps that could highlight areas for future practice. And we're looking to test this use of this approach in a couple of geographical areas and learn from that in the coming year. The third recommendation is to promote awareness of universal interventions identified as being promising, and those where the strength of evidence of impact and relative costs have been evaluated in the Early Intervention Foundation guidebook. So if there is a take-home message for people listening to this about where do I go to find a summary of what the evidence says, I would highly recommend they Google Early Intervention Foundation guidebook, because the EIF have done a lot of work analysing and reviewing evidence and presenting it in very user-friendly format. And then finally, this recommendation around ensuring the views of children and young people are used alongside evidence from research and insights from data and intelligence to inform policy, research and practice. Because you find that children and young people's views are very grounded, they'll bring perspectives that the academic literature may not have picked up. And at the end of the day, the interventions and the way we work to address mental health must be acceptable to the young people that we're seeking to influence. So by way of close, I've just given you there a quick extract from the Early Intervention Foundation's guidebook, so you can see what you'll find when you visit that portal. Very user-friendly summary of evidence and the cost ratings, the outcomes, and you can search that in quite a user-friendly way. So I hope that's been helpful. And yeah, I'm going to leave it there. Those are my contact details should you wish to follow up with me. Many thanks.
Thanks, Claire. That's great. I was just wondering, in follow-up to that, do you have any ongoing projects that will update any of those findings at all, or that you think will help shed a bit more light on ways to move forward?
Yeah, we're going to publish the report of the special interest group, which will have all of that information in the report and links to the findings from the children and young people's workshops and links to some of the outputs that will be useful to commissioners. So what I will do is let Sylvia have the link to the published document as soon as it's available.
Excellent. Thanks very much, Claire. If anyone would like to get hold of that, please drop either Claire herself or Sylvia a message. Next up, we're going to have Sean Russell of West Midlands Combined Authority, and he'll be speaking in about 5 minutes if you want to quickly grab a drink or check any emails. Welcome back, everybody, and thanks for joining us today. Next, we'll have Sean Russell of West Midlands Combined Authority speaking. Sean Russell is Superintendent within West Midlands Police. He is currently seconded to the West Midlands Combined Authority as the Director of Implementation for Mental Health, Wellbeing and Radical Prevention. He has spent most of his 25 years' service within Birmingham Command Unit in operational roles. He spent 3 years as a Public Protection Manager, where he was the Senior Investigation Officer for a number of child homicides and domestic-related murders. He has also worked in Birmingham City Centre and the surrounding areas, where he was responsible for partnership engagement and NH policing delivery. Sean has a keen interest in policing mental health and the impact this has for both the service user and the police. He led the development of mental health triage projects and is involved in the National Liaison and Diversion Pilot, where mental health staff work more closely with the criminal justice system and the development of community sentence options. He currently leads a large number of programmes including Thrive Into Work, Thrive at Work and 500,000 Literacy Campaign. He is determined to ensure the West Midlands approach to wellbeing is embedded in all policies and improves the impact of poor health inequalities through better connectivity across the system. So, Sean, hello, and I look forward to your presentation.
Hello, and thank you for letting me come and do this webinar with you today. And I think it's quite an exciting proposition, really. So I want to just do a bit of a background as to who I am, and then what makes me able to talk to you today, and then hopefully we can then walk through my slide deck and try and get you to understand why we think this is so important for the West Midlands and actually for the national economy. So my starting slide, as you can see, we said, who wouldn't want to work for a company that cares? And I think that for me is the ultimate bit. We start off in our careers working, and I've got probably about 30 odd years work experience now. And some of that has been really great. Some of it hasn't been so great. Some of that is built on the premise that actually I've had some really great people that I work with, and other times I haven't. So it's really important that I actually start to think about the environment that we're working in and actually how that develops the whole approach that we're trying to deliver throughout this presentation. Because the thing for me that runs through all of this will be about the culture. So hopefully you'll find that through the presentation today, what we're trying to achieve here is a really good sense of making the West Midlands a happier, healthier and more fun place to be, actually, because that's ultimately where I want to be, and I want all the people I work with and my staff to feel, but also for the wider West Midlands. So I'm very lucky in my role to be the Implementation Director for the West Midlands Combined Authority, which is a great organisation that covers a population of the West Midlands of about 3.2 million people. So it enables us to do some work that nudges the practice and behaviour of people in a really broad way. So not only do we cover the 7 metropolitan areas of the West Midlands, which would be places from Wolverhampton right the way down to Coventry, but we also include places like Warwickshire, Redditch in Worcestershire, Cannock and Tamworth. So actually we've got a really, really broad dynamics really around the type of area, the type of place that we operate within, but also, as you'll recognise, that actually businesses are all very different, and that covers a whole host of business types, from manufacturing right the way in the centre of Birmingham right the way through to agriculture on the outskirts of Warwickshire. So all of those have different challenges for workplace wellbeing, and I think I want to try and unpick some of that today. So what I want to do is, when you look at the next slide, when you look at your team, what do you see? Do you see a group of people who are sat there not really sure what they're doing, a little bit downhearted, actually a little bit bored, that we're not letting them grow to their full potential? What do you see? It's really interesting, actually, because when you look at teams, everybody's different, and we need to recognise that. But actually, we realise that a really good, productive workforce is basically working around a company that has really good visions and mission, and has a really good understanding of where they're going, and actually has real good buy-in from the people that work there too. So if you're able to think about actually how to encourage flexibility, that caring family approach, you'll get a much better response from your staff. And I know what I try to engender in my teams and throughout all of my policing career and my previous careers before that, that actually if you look after the people like you would look after, be looked after yourself, or as if they were your family, actually you're going to have a really good response. So this is a bit around actually, what do you see when you look at your team? Are you an optimist? Are you a pessimist? Actually, everyone has the potential to be good, and we'll cover that a bit later on in the slides. But actually, this is really important that we start to get the culture bit right at the very, very beginning. So what we did is, in the West Midlands, in about 2016, the West Midlands Combined Authority, in its shadow form, actually realised that there was a couple of things that we needed to do to really turn the dial of the way that economic growth was going to change within the region. First of all, we needed to think about what are the levers that are coming into us to really support our growth. High-speed rail coming through into the region, the opportunity working with the government to build 215,000 new homes, development of various types of industry, so whether that's through the economic industry, through financial businesses, for example, HSBC coming into Birmingham. We put the pitch in originally for Channel 4 to come to the West Midlands. We started to think about actually where can we lever that opportunity to make the West Midlands a really great place to be. But understanding behind that, one of the also things that we looked at was actually that mental health provides a really significant challenge for the West Midlands. And I'll give you some stats in a little while. But what we did is that we really made sure that actually if we started to think about the issues that were raised in our area, we couldn't really make an improved economic case without starting to think about people's health and well-being. And if you start to think about healthy life expectancy, which I'll go into a little bit later on, actually we are not that great in compared to the All England average. So we really need to do something to be really, really great in the West Midlands. But to do that, we've got to look after the people. So the Mental Health Commission was chaired by Norman Lamb, the ex-Minister of Care and Support, and he came up to help us to really shape what we could do. And we were supported by people like Swaran Singh, a professor at Warwick University, Kevin Fenton from Public Health England nationally, and Dame Carol Black with her interest in work and health and older age adults. So we had an expert group that really pulled together a really good sense of what the issues were for the region, but also what the national good practice was. But we also linked that into businesses as well, which I think was absolutely critical for us, to include people like Paul Anderson, who was the Managing Director of Deutsche Bank in Birmingham, really to give a sense of what the Chamber of Commerce's and the LEPs could do to support this agenda moving forward. The programme was actually commissioned by the Combined Authority and NHS England, because we recognise that actually this isn't all just about the health sector, it's about the wider sector, and actually if we can all do a little bit, actually will make a real difference to the region. We were really clear though at the very start that we wanted to focus on working age adults, because actually we could have thought about the whole age spectrum and got right into the age of school kids, getting into that younger adult, the adolescent space, and actually into the older adults. But what we wanted to do was focus on the working age adults, because we recognise that actually people in the working space, especially now, are probably going to be there for between 45 and 50 years. And it gave us a real great opportunity to really think about actually how we could work with employers and businesses and the wider community sectors to be able to turn the dial and do something different. So what we plan to do is to create some recommendations to government, to work with the Combined Authority and the NHS, and actually how could we use some of the opportunities and things that we saw as an opportunity for devolution moving forward, and using the powers of the Combined Authority with the directly elected mayor to really shape the way that we delivered our programme moving forward. But ultimately, what we also wanted to do is we wanted a concordant approach. We didn't want to do to our partners, we wanted to do with, and absolutely this was consistently the message around consultation. And everything we've done from all of our programmes so far have been absolutely in consultation with the public, as well as our statutory partners and our charity sector, because actually we have to have everybody brought into the process. Otherwise, we're never actually going to move forward at all. We may do little wins, but actually they won't be sustainable. So it's really important that we recognise that. So what you'll see there is some photos of our citizens' jury. This is really interesting for me, because one of the things that we really wanted to do, not only did we have the expert panel, but we really wanted to go out and speak to the public and get a sense of what the public really thought about the services and the provision around mental health in the broader terms in the West Midlands region. So we went and did a lot of listening events where we spoke to people in their community venues, we spoke to carers groups and a whole host of various groups over probably about a 9 to 12 month period. And I think it was about 120 events we went to overall. And from that, we recruited a citizens' jury. So these were people who were brought in to support us to really shape the way that their issues that they brought with them could be addressed at a system level. And that was absolutely fantastic, because it gave us an opportunity to have the voices heard of people whose potentially voice hadn't been heard before, to bring a real spectrum of thought into the space. So there was a mixture of people who'd never worked, there were people who were just leaving university, there were people who had worked but actually been moved out of the workspace very early on in their career because of their poor mental health, and were managed out and actually hadn't been at work for about 35 years. Which is actually, when you think about all of the training that went into that individual and the value they could have added back to society, not only on a personal level were they feeling undervalued and under-supported, but actually economically and from a business perspective, we realised there were some real challenges there. So they've been absolutely critical to us moving forward, and we've retained the citizens' jury, probably not as well as I would like to have done, but actually in format now, which is being reconfigured now with a view to moving us on. So our programme actually landed on the 17th of January 2017, sorry, the 31st of January 2017. So actually we've been running now for 2.5 years, and it's really, really good. And actually we've had consistent commitment from our citizens' jury and our partners throughout that stage. So a little bit of facts really about the West Midlands Combined Authority area and some of the reasons why we did what we did. Well, ultimately we had a £3.9 billion fiscal gap that was in the West Midlands, and that was the big elephant in the room. So actually the money we were getting from the government, the money we were getting from local taxes and the precept of business tax and poll tax, or your council tax as it is now, was really, really clear that actually we had that gap emerging, because we have, if you imagine Birmingham with the youngest population in Europe and a growing elderly population, because we're all living that little bit longer now, the requirement for social care, both adult and children's, is really significant. And actually the expectation from the public that we do lots more was absolutely visible. And we really needed to think about that. So let's just throw some stats at you. We've got 70,000 people in the region who are inactive through poor mental health problems, who are receiving that employment support allowance. The mental health in the region costs us £12.5 billion a year. That's all of the money that is spent purely on mental health. So that's really significant. That works out about £3,000 a person. The cost of pure economic inactivity for the people not in work, we estimate is about £2.2 billion. In 2015, we had 477 suicides, and that's a really significant challenge for us, really. Working with the NHS, their long-term plan and the 5-year forward view talked about a 10% reduction. And to be honest, if we're only going to reduce it by 48 people, that doesn't feel significant enough for me. And we are pushing absolutely hard for a zero suicide ambition. The challenge we've got is that there's been two things that have occurred over the last couple of years. First of all, about the recording of deaths from the coroner has changed the burden of proof. So therefore, more people may actually fall into the category now of having taken their own life through suicide compared to history. But actually on the opposite side, we recognise that economic times are really difficult, and the number over the last few years is still growing, with 523 last year. So this is an area, as a region, we're really committed to try and change the dial. But we recognise also from a health perspective that the mental health costs about £1 million to the crime budget. And being a policeman, you'd experience and expect me to be talking about that element of it. But actually, when we talk about people in prison, 90% of people in prison actually have a comorbid mental health or alcohol or substance misuse. 43% of people in prison have a diagnosable mental health condition. So we've really got to think about how do we prevent people accessing the justice system at an earlier stage by being a bit more preventive in our world. And then finally, actually, we lose 4.1 million working days per year within the West Midlands through poor mental health. Now, actually, if you start to turn that into people issues, the amount of time people are having off work, the implications that has for businesses and employers, but also the wider system around primary care and secondary care in the hospital setting or EGP, actually it's significant, and we need to really think about that. So we published the Thrive West Midlands Action Plan, and that was published on the 31st of January 2017. So what are we about? Well, I have a view that says that what we're trying to do is create a public health commitment to improving the way that mental health and wellbeing is considered, both in the workplace but wider. We really think about, if you look at the lovely rainbow diagram there, the Dahlgren and Whitehead diagram, talks about all of those social, economical, cultural, environmental conditions that require a person to thrive. But understanding, actually, we all have our own individual lifestyle issues. There are social and community networks that we're connected to, whether it's our families, our friends, our workplaces. And all of those are influenced by the healthcare we receive, whether we're unemployed, whether we have water or housing, whether our living conditions are good or not so good. And all of those things are also underpinned by our age and our sex. And actually, some of the demographic areas in the West Midlands are really interesting when you have some of the most deprived areas in the UK within the West Midlands, but also no more than a stone's throw away some of the most affluent areas too. So we've really got to understand, actually, at a universal level, how we operate in that space. And you can see my little Lego policeman there, because actually I reckon that health improvement is everybody's business. I don't make a distinction that says this has to be laid on the hands purely of the health sector. Everybody has a part to play, whether you're an employer, whether you're an employee, whether you're the janitor in the school, whether you're a teacher, whether you're the person driving the bus. Everybody is absolutely and should be committed to improving everyone's health and well-being. So you'll see on the right-hand side of the slide deck the commitment, and that was the Concordat for Action that we created. I have to say that's probably made me a little bit more grey than I was before, because getting everyone to agree to those 3 statements was very hard. But we ended up with about 100 businesses and stakeholders who signed up to our pledge to say that they would work with us consistently. And actually, I have to say, they fulfilled that commitment and they're working with us still now. And we're growing every day stronger and stronger. So what do we focus on? Well, we focus on employment skills because we recognise that actually if you can look after people in the workplace well and get people into work, actually everybody benefits. Now, I wasn't going to get political on this webinar, but actually, you know, with Brexit, there's been some challenges around the thought around people leaving the EU and actually all of the workforce migration back to home countries. If we use the 70,000 people plus another 40,000 people who are physically inactive and unable to work through disability, we actually have about 110,000 people in our region who could do some form of work. And actually what we're trying to do now is to start to think about that and start to think about how do we encourage people into work. And when I say work, it is good work, not those 0-hour contracts, because actually good work has to be good for people. So we're running a number of things to try and improve that process. So focusing on the employment and skills, we're running an IPS program, which is an individual placement support program, where we're trying to get people back into the workplace. We're running it as a randomised control trial, which finishes on the 31st of October. But our ambition was to work between 7,000 and 9,000 people in the region and trying to get about 1,000 of them back into work. Really significant, because these are people who are at the really sharp end of worklessness, really. These are people who've been out of work for at least 28 days, who have a self-diagnosis or a clinical diagnosis of mental health or poor physical health. And what we've recognised actually is quite a lot of people actually who receive support are actually wanting to work, but they lack the motivation or they lack the confidence to be able to go in. And our whole approach working with employee workers actually isn't to give them the jobs that we think they want them to do. So we're not saying to them, we've got a shortage of plumbers, you're all going to be trained to be plumbers. We actually speak to the individual and say, what would you like to do? And interestingly, we've had some really fascinating pieces that we've got people into aeronautical engineering, somebody into a lecturing role, someone working at a radio station. All of those things are really, really important to us, because actually that gives value to those individuals, and starting to think about that. But also building on that, we have, so that's our Thrive Into Work programme. We have a Thrive at Work programme, which is a programme of work where we're focusing on giving employers the tools to be able to look after their people better. We've created a commitment that has a bronze, silver and gold level intervention. And what we're doing is we're working with the public health teams, both locally and nationally, and providers in the region to talk about actually what good looks like. And for that work, what we're making sure is that we engage managing directors and executives within organisations to sign up to it and take part of the pledge. But also then to work in a bottom-up approach as well within the organisation to understand actually how can people take a bit of responsibility for this agenda and help it move forward. So really interesting, we're focusing on mental health. We're focusing on musculoskeletal issues, so that's bad necks, bad knees and bad backs. Because actually 67% of total absence in the workplace is those two issues. And some of that may be stigma related, because you may not wish to tell your boss that you're off with stress or anxiety, but you're quite happy to tell them that you've got a bit of a bad knee or a bad back that may actually be a symptom of stress and anxiety. So it's really interesting that we're working with our organisation to do that. And so far, we've signed up about 320 organisations within the last sort of 12 months, with a reach of about 135,000 people and employers who are potentially being reached by this programme. Now, you might think actually it's okay, that's just for the big companies, and absolutely, you know, we've got one of the health organisations in the region with 22,000 staff involved. But on the other side, we've got a small architect firm with 2 people in it, and they recognise the benefit, even if it's just doing it for themselves, because the return of investment that they're starting to see around the things that they do, it doesn't cost a lot, and some of it is actually free. So, if, for example, to improve your physical activity, using the stairs instead of taking the lift, having a walk-in supervision session instead of actually sitting in your office and sitting at a desk and doing it, bringing in the picnic lunchtime once a week for a healthy lunchtime. You know, trying to stop the people bringing in the donuts and cakes actually is probably never going to work. So actually, how do we just focus it in a slightly different way? So we give people the tools to be able to do that with a host of things around policies and procedures, and helping them share generally with other people through network meetings what they can do to try and move that agenda forward. And that's proving really, really positive. The next thing we're going to talk about very quickly is around housing first. So in most of our urban areas, you'll see lots and lots of homeless people. And one of the challenges for that is actually what puts people on the street in the first place is probably due to a challenge around homelessness because of poor mental health, poor physical health, or actually trauma and abuse in early years, or actually in later life as it goes through. So we're really determined to do something different with that. And we're working with the homeless team as part of the Mayor's agenda to ensure that we focus on that. And what we're trying to do is make sure that the mental health agenda is actually brought together to support those individuals. Because ultimately, we've got about 617 people to work with over the next 3 years and get them into a house and then get stabilised and then get them into work. So my ambition would be to get homeless people back into work and supporting, adding value, because that's ultimately what most of the people want. Criminal justice is really interesting because actually we're determined to try and think about first-time offenders in the system who've done something because of poor mental health condition, and actually how we might be able to look after them slightly differently and give them treatment rather than sending them to prison. That's really important to me because actually there are lots of people who make mistakes and we need to learn by that. And sometimes that isn't necessarily by pure desire. Some of that might be that actually have done something because of the circumstances which have arisen around them. A really interesting story was a female who got convicted of drink drive. She was drinking to self-medicate because she was anxious. She effectively then lost her job and was about to lose her family. Trying to get people like that into treatment is much, much better than dropping them into the justice system where actually it's a notifiable issue for them from the work position. And therefore potentially will stop them working in the future. This isn't a soft option actually, but it's really making sure that we really start to look after people and give them a chance to really rehabilitate. At the same time, we're trying to develop the wider care agenda. This is really important because what we're trying to do is turn the dial on the issue around perinatal mental health, because actually it was a really important that we look after mums and who hear voices, and certainly mums who have postnatal depression, and start to think about how we improve that, because actually we've got one of the highest death rates actually in the country for young children. So what we want to do is make sure that we join all the dots up to make sure that everyone gets the best opportunity and the best start in life. That also includes the work we're doing around suicide, but it also includes lots of other things around how we can focus physical health and mental health together, and also how to improve the GP approach to mental health and start to think about primary care mental health provision. And that might be testing some things like putting mental health nurses into GP surgeries, and little things like that, which are really, really simple. Cost a little bit of money, but actually the return of investment seems to be going pretty well. And then wider bit is about community capacity building. So you'll hear from other people on the webinar around mental health first aid, and we're a really big advocate of that. We've got an ambition in the West Midlands from the Mayor. We will train 500,000 people in mental health awareness. So we hope that about 150,000 of those will be mental health first aid over 10 years. But actually what we're also doing is doing some other work as well. So in October last year, we launched the One You campaign, which was a pilot across the East and West Midlands as a digital platform for people to test and see how they were feeling around their own physical and poor mental health. What it does, it gives you a toolkit actually to help you. And things like, are you sleeping okay? What are your relationships like? A little bit of understanding around, anxiety and depression, but really giving you the tools to try and help yourself actually before needing to go to care, and a really good preventative space. And that's due to be launched again in the next week or so. So that will be really great. So look out for the adverts on the telly, adverts in the papers, and I'd urge everyone to go on and use it as a bit of self-reflection time, because actually on an aside, we've got an ambition to train 1 million people in this across the region. So if you can get it into your workplaces, get it into yourselves, just open it up and have a look at it, it'd be great. And then finally, we have a Walking Out of Darkness event, which is a bit of a sponsored walk, which takes place every year. We've moved it this year from October through to May next year. And we're trying to raise the sort of awareness raising around suicide prevention, but also the Equality Act, because the bit for us is actually mental health is a disability if you've had it for more than 12 months, and therefore it's covered by the Equality Act. But what we also recognise is the anticipatory duty of organisations to anticipate people who come into contact with them or their own staff needs to be addressed. And actually, not many organisations in the West Midlands are actually in a position yet to do that. You only have to look at websites actually around accessibility. And actually, most of us are able to show that we do large print or braille, or we can offer it via audio. But actually, if someone's got anxiety, what does that actually mean for them? So actually how might those websites be adapted slightly for people who might be feeling differently. So it's a really interesting area of business. So we've talked a little bit about Thrive at Work and Thrive into Work, and you'll see some of the issues there that we're trying to do. And actually the web pages are available for you to all have a look at, and I'm not going to dwell on that. But actually for me, this is the culture piece. If we can get workplaces to look after their people better, it means that you'll retain your staff for longer, therefore reduce your bill around recruitment and also keep your training bills lower. But actually then having people into work means that actually when they land in the workspace, they have an understanding that the organisation will support them in a really clear way. And that's much better, because actually then you get that brand loyalty creeping in, which is so important. So adding all to that, actually, I really recognise that physical activity is a really good way to help you start to think about poor well-being. So if you start to think about actually how often are we getting out and doing our 30 minutes of exercise every day, how often are we making sure that we get those plans in place to really think about your own well-being. And one of the things I try to do with my own staff, and I've done it because of working a lot of work with Mind over the years, is when we do our PDR discussion, we have a conversation around well-being and what can we do that enables you to stay well. So, for example, it might not be coming in at 8 o'clock in the morning because, if you decide that you want to go swimming for 2 mornings a week before coming into work, that may be really important, because if that's the thing that keeps you well and keeps your levels of anxiety and stress manageable, as managers, we should be flexible enough to be able to facilitate that. But also, how do we sort out those lunchtime runs, those walks down the canal networks? You'll see on there's an organisation called Good Gym. That's an organisation where we're getting people to go out for runs and do a good deed. So, for example, we'll meet on a Tuesday night, we'll run for about 2 miles, we'll go and paint a school fencing, or we'll go and pick litter up in a park, or we'll go and help an old people's home and do some work. All of those things are really, really important, and actually makes you feel like you're giving a bit back to society too. And all of those are actually underpinning the West Midlands on the Move agenda, which the Mayor, as you can see in the photo there, is absolutely keen and critical to supporting us moving forward. And we've also then just about to launch our healthy weight plan actually for the region. So we recognise that childhood obesity and adult obesity leads to poor cardiovascular disease, lots of chances around diabetes. All of those things are really, really hitting our society now. So what we're trying to do now is to layer in mental health, well-being, physical activity, healthy weight, trying to make sure that actually we give everyone the best opportunity to be the best they can be, and therefore everyone then will thrive. So part of that, this is about getting our message out. We try and get publications out as often as we can. We get into the Financial Times, we've got into the Guardian, we get onto radio and TV whenever we can. This isn't about us being egotistical, but actually this is about us getting out there and spreading the message that everybody has a part to play in this, and we really need everyone to move the dial forward. And actually we put people at the centre of everything we do, therefore we'll get a much better outcome. So for me, this is about now spreading the word to you who are listening in today, and actually how do you then make sure that you get your words out in those publications and start to spread the message for us and then on our behalf. So I've been speaking now for about 20 odd minutes, and for me it's really important that we recognise that it's more than just the system. At the very start I talked about culture, I talked about people. This is for me the fundamentals of all of this. We can do some really great things by changing the system, and actually that would be lovely, and we'll put a new policy in, or we'll write a policy and it'll sit on the shelf and get very dusty. But actually culturally we've got to make it land, and we've got to work collectively to do it. And I see Thrive as a bit of a social movement. So if you just start to think about the updates that are there on the page in front of you, our Thriving programme to get people into work, we've got 302 people into work now already, with another 1,000 people who are doing their profiles currently so we can get them into work. I've talked about our Thrive at Work programme reaching 135,000 employees, 42,000 people who've done their mental health first aid training. And I just wanted to say, actually, we haven't paid for that. Actually, that's businesses who've done that of their own volition, and seeing the recognition around that. So if you think about your workplace agenda, most of us will do our workplace first aid because actually it's important that we look after our people both physically, and actually there's nothing in the Health and Safety at Work Act 1974 which talks about the difference between mental health and physical health. It talks about health, but we've interpreted it because of industrial accidents over years and years and years to be physical health. So we're now advocating to say, well, actually you should have an equal number of mental health first aiders in the workspace as you do physical first aiders. Their pictures should be up on the board the same as they do for physical first aiders, and they should be supported in the workplace to enable them to do. And I bet anyone, to tell me that actually their workspace has more work from the physical first aiders than they do the mental health first aiders, because working with lots of organisations over years, I have found that actually mental health first aiders are a lot more used, a lot more than actually the physical first aiders who are putting plasters on or supporting people when they have an incident. So that's really interesting, and I would urge everyone to really look at that and move that forward. We've put 77 homeless people into homes now since we launched in December, so that's really, really good, and hopefully that number will grow before the winter comes so we can start to get more people off the streets. And the good gym I talked about has landed in Birmingham, Solihull, Coventry and Warwick. They've got a great website, so I'd urge you to have a look, because actually if you only do it once or twice, it gives you a real sense of achievement that you've been out there and done something with a load of other people. And you don't have to be, the Usain Bolt to go out and do this. It's an all mixed ability network, so it's really important, and it's a great way to reduce that social isolation as well. So this is what I see when I see my team. I see a load of individuals, a group of people who are really superheroes. Everybody has got their own issues. We absolutely accept that, but actually we work through that in a really, really positive way. What we're trying to do is to make sure that we recognise in all of our workspaces that, a bit like we did with diversity, where everyone is different, that actually we really focus this moving forward and really take this agenda to ensure that everybody can help us grow. So if you just look at the Incredible Hulk in the middle of this picture, what do the team around him do to stop him going green? They work with him, they support him. There are times they want him to go green, because we all have people in our workforce that we need to be that little person who's the person who takes the extra step occasionally to be a bit more prompty, a bit difficult at times, because actually the scenario at that position may need it. But actually, we want everyone to be the best they can be, but also be happy in their own skin to be the person that they really are. So to do that, actually, we need to think about the nature of the work. We need people to feel valued, they need to be understood, we need to make sure that actually they're given support to do the work that they do, and trained sufficiently to be able to do it appropriately. We need structures and processes. That's not without saying, but actually everything we do has to have a very clear approach. And actually if it doesn't feel like it's joining up and linking up to everything else, the added value position for that individual just won't be met. And if people start to work in silos, they don't see the bigger picture and they get really bored very quickly. We also need to think about psychological safety. So I'm a really big advocate of this, that says actually, how do you make your workplace safe? A place where you can have those open conversations and you won't be held accountable, or you won't have your future career blighted by the fact that this occurs. Now, interestingly, we run a campaign called This Is Me. It was started off in London with the Lord Mayor appeal, and what we tried to do is to encourage businesses to have leaders and managers and staff in the organisation to put to video their story. So it's a bit about storytelling, it's a bit about stigma reduction, but actually, when you listen to a chief executive who's describing to themselves and on the video that they suffer with bipolar, and they've really struggled. They have really, really bad low days and really, really manic high days. And actually they have to work through that, yet they've still managed to get to a chief executive role. Actually, it should empower us all to think actually that it's suitable for us all to do some really great stuff. But what we also need to do is actually make sure that our managers act appropriately and support the individuals. And that goes back then to leadership and management, because that's really, really important that actually we get this right. And then it goes back to behaviours, attitudes and beliefs. Do you know what? We all get a bit grumpy. We all get a bit tired. We all get a bit upset at times. Life inside of work and outside of work sometimes overtakes the way that we are. And sometimes that creeps into the workplace. And we really need to think about that. Sometimes that happens, and sometimes our behaviours and our attitudes don't necessarily are not the positions that we would normally be. So we really just need to have that little bit of insight into ourselves to think about actually how do we do this, how do we work forward, and how do we ensure that across the region we enable those attitudes and stigmas to be reduced and therefore create the best space for our people to thrive. So finally, 3 reasons why Thrive works. Well, you'll have heard me talk today about a whole system approach, making sure that we link the community and the systems together, whether we listen, when we hear, and actually we then feed back to the community about what we're doing, because that's really, really important. But actually the Thrive programme has shown a really clear evidence of sustainable collaboration. That's really clear leadership from lots of us in the system who are really trying really hard to make a difference to the work that we do. You think about people like Anne and Guy Daly at Coventry, and the things that they're doing is just phenomenal, really. And equally the work that we're doing across the Midlands Engine with people like Caroline Mayer from Warwick. There's some amazing things going on with some amazing people, actually, and what we're trying to do, therefore, is make sure all of that goes on. But actually recognising that actually we couldn't be doing the jobs that we do without all of the people underneath. You know, we have lots of people supporting us to make sure that all of the things that get done and get asked to be done really get followed through. So the next thing is that there's a real evidence that is having a human impact, and that's creating an energy to do the right thing. So you'll have seen the photos of the citizens' jury, and it's really great to see those individuals have absolutely thrived in the last 3 years. You know, finishing university, going on to get work, and interestingly, on the slide where I talk about the whole system and the positive impact we've made, Steve Gilbert there, who sat down, who's wearing the white T-shirt, has actually done some amazing things, and he's recently been the vice chair of the Mental Health Act Review Committee. And you know, and he wouldn't mind me saying, but actually he's an individual who has his own challenges around poor mental health, but has worked really, really hard with lots of people around him, especially, you know, he's got a very, very close friend, Kathy, who's been really supportive to really drive this agenda forward and help him to really be the best he can be. And actually, because of that, he's absolutely doing amazingly well. And then actually what we are then seeing is green shoots. So all of the things we've done, we've started off at small scale, but actually we're now thinking about amplification, how that scales up, and all of those are really, really important. But I have to say that we're also learning and improving, because what we started on three years ago isn't necessarily what's right for the region now. So we have to organically look at this to make sure we collectively work together. And we have a really good setup through the Wellbeing Board for the Combined Authority that feeds into local wellbeing boards. We're still linking with all of our citizens groups, and we still try to get out as often as we can to speak to people who are really at the sharp end of businesses and industries and communities, and really get that sense of what's going on, so we can come back and think about policy and design moving forward. So thank you for listening to me this morning. I hope it's been an interesting webinar for you, and if there's any more information you want, feel free to drop me a line or to visit our webpage at the WMCA, so Thrive on the West Midlands Combined Authority. Thank you.
Awesome. Thank you very much, Sean. Couple of questions.
Yeah.
First of all being, are there any schemes that haven't yet taken off which you're quite excited about the prospect of? Say ones that are in the work with people you've worked with on a local level and they're still sort of planning them out or just about to implement them?
Yeah, absolutely. So the first one is the Midlands Engine work, which is a piece of work we are going to work across the Midlands Engine. So that will take us effectively from Hereford over to Telford and Wrekin, up to Nottingham, down to Loughborough, right the way over to Lincolnshire. And that's a work where we're working on a product called Mental Health and Productivity. We were lucky to obtain a grant from the government through the Midlands Engine, just short of £7 million actually, to do some work. And what we wanted to do now is to work with the local enterprise partnerships, the chambers of commerce and businesses, and the university sectors, actually, of which Coventry are actually one of the leading universities, both Coventry and Warwick. So we're collectively going to try and improve the workplace wellbeing agenda and roll out the work that we've started here into a much wider sphere, so we can really help us move that across the Midlands Engine. And when you put that into context, 495,000 businesses across that footprint with a population of 10 million people. So if you think that's a sixth of the UK, If we can get that right there and start to make a difference, actually the growth of the economy within the UK will start to improve, and it will add a real value to the people and make those, what effectively the squeezed middle of the UK, feel a lot more better.
That's great. At a local government level, are there any policies you think folks should really be lobbying towards or lobbying for?
So I think if I was to go and ask people to lobby policy, I think the one thing for me that's really important is prevention. We really don't invest significant amounts of money in prevention. And the Green Paper that was published earlier on this year, about July, from the Secretary of State, was very, very clear that we need to start to think about a whole host of things in a preventative way, whether that's childhood obesity, whether it's social isolation, whether it's workplace wellbeing. All of those things really need to start to play out. But also at the same time, we need to think about the investment, because actually we spend about a penny in every pound on prevention, whereas we spend about 7p in every pound on the acute crisis care. So we've really got to think about what we do and how we do it. And what we want to do is really think about and develop a number of programs of work which will give us the evidence base to prove that prevention works. Now, understanding that this isn't going to be a short-term game, it's absolutely going to be a long game that we're going to be working here, but there are some things we can do very short-term that will start to make a difference. So just for example, how do we think about wearables, digital wearables, because actually our area will be a 5G digital footprint for the UK. So how do we maximise on that? How do we develop apps that create gamification to get kids more active? How do we use things like the Amazon Echo Dot or to support people who are isolated in homes, so we can get them into having conversations with other people? So I think there's a great opportunity for the Midlands to be that digital hub, that be in a digital innovator, and really work collectively to be at the heart of some amazing things. You know, and we all go back to the 1960s and talk about putting a man on the moon, and everyone was saying you'll never do it, and then 9 years later that occurred. It actually feels like it's a bit like that now. We are really at a point where mental health is being talked about all the time, whether it's through the royal family, whether it's through workplace, whether it's on the news, and there's a really positive message now starting to come out. So we need to capitalise on that now and make sure that actually if we're going to improve healthy life expectancy for the people in the region, and we're going to make people feel better in the workplace agenda, we've really got to take this opportunity to do as much as we can and drive that activity forward.
All right, nice one, Sean. Thanks. That was really insightful. Next, we'll have Diane Phimister from the University of Coventry speaking in about 5 minutes' time. So if you need to grab a drink or fire off any emails, we'll see you back here in just a moment. Including the development of a focused service underpinned by a sustainable, doable strategy. Diane also leads a team of mental health first aiders who have trained over 2,000 students and around 500 staff in mental first aid. I'll now hand over to her herself to speak about mental health and first aid at Coventry University.
Thanks, Dave, and thanks for the opportunity to share our experiences of mental health first aid here at Coventry University. My name is Diane Phimister, and I have the privilege of leading mental health here at Coventry University. We first started looking at mental health first aid at Coventry around about 4 years ago. So what I'm going to do, I'm going to take you through a series of slides that tell you what we've been doing, a little bit about mental health first aid and next steps really. So what is mental health first aid? So quite an ambitious vision in terms of mental health. It's worldwide now, actually, mental health first aid. And so their vision was to improve the mental health of all people and encourage people to talk about mental health. We're saying it's really important for people to recognise that mental health is a positive thing, and to be able to get out there and talk about how they're feeling, but also have the tools in which to be able to talk to other people. It started in the UK in 2007 and it's been endorsed by Public Health England. The idea of mental health first aid is to equip people with skills to be able to recognise in themselves, but also to recognise if somebody else is having a bit of a challenge in relation to their mental health. And so it's very much around recognising those signs, those symptoms, taking a non-judgmental stance toward this, being able to listen non-judgmentally, and then how to signpost people. Mental health first aid is very clearly not a means to develop people as therapists, but as a resource and a toolkit for people to be able to access, to be able to contain another person's anxieties, contain another person's distress, but then also signpost them to support. There's quite an extensive range of courses available in terms of mental health first aid. So we have the 2-day adult course, which qualifies somebody to be a mental health first aider. So quite a comprehensive course in relation to understanding the challenges, the stigma that goes around mental health, recognising the signs and symptoms, and being able to use the toolkit that mental health first aid provide in relation to being able to address that. So that's the 2-day course. There's also a 2-day course for children and young people. Alongside of the 2-day courses, we have a number of 1-day courses which qualifies people to become mental health first aid champions, which means they understand the challenges and are able to signpost, but not necessarily the full range of mental ill health conditions that we know about. So there's a particular course, a 1-day course around higher education, which we roll out quite extensively across this university. And there's also courses for the armed forces, which we don't engage with, to be honest, here. So, but we do offer the full range of 2-day, 1-day, and then the half-day awareness course for adult we roll out here at Coventry. So why is it important in higher education? So students coming into higher education, it can be a bit of a perfect storm in terms of developing poor mental health. So students may be living away from home and having access to the usual support networks. It may be that students are still at home actually, and for them they may have caring responsibilities, so the pressures of those. Stress of moving, we all know the stresses of moving, study pressures. We do expect students to come to university and engage with their studies and deliver assignments. Finance and debt is clearly a challenge for our students. The uncertainty, a student invests in 3 years of their life into university, and will they get a job at the end? Has it all been worth it? Has all that debt been worth it? Peer pressure. You know, we know that some of our students want to have that sense of belonging, want to feel that they belong to a group, but it may be that that particular group enter into practices that they're not necessarily that they've done previously. So it might be that they go out drinking, when actually for that particular student it's quite difficult, but because they want to belong, may feel pressurised into entering into that sort of arena. Might just be basically homesick. So students have some challenges, but then also staff that work within the university also face challenges. We recognise that actually to be able to provide a positive student experience, we need to be able to also look after our staff in terms of providing them with an environment alongside the students where they feel happy, that they can thrive and that they can contribute. Because we know that staff can feel quite isolated, long working hours, particularly if it's in the round of exams or if there's marking due in. Personality and personal and university performance measures, so in terms of the targets, we all like to be seen to be moving up the league tables, the National Student Satisfaction Survey. We all want to have really good metrics in terms of those tables. But as a university, we have a responsibility to address all of that, but like I say, providing an environment where we look after each other in terms of well-being and also mental health. Some of our courses, particularly our health courses, and in one of our faculties, the Faculty of Health and Life Sciences, we offer a range of health courses which cover professional courses from paramedic science right the way through to all sorts of nursing. So, and for our students, what we say, we want them to be able to address the mental health needs of people that they come into contact as part of their everyday practice, as well as the physical health needs. So we need to be able to ensure that our students go out into clinical practice fully equipped. So in terms of the students in particular, when we look at the student context of some of the challenges around mental health, what we're seeing is an increased student presentation to our student mental health and our student welfare services, and this is something that we know is going on across the whole of the higher education sector. And what we're also seeing is an increased severity in terms of the presentation. So for example, last year we saw a 70% increase of students presenting with some really significant mental ill health issues, a number of students actively suicidal, a number of students who are presenting with quite difficult psychotic symptoms. Now, so we've got that going on, but one of the great things that we think it's fabulous is that there has been a change in attitudes towards disability, and obviously mental health comes under that umbrella, and therefore we're seeing more students coming to university, feeling able to come to university with a diagnosed mental health condition and engaging in studies, which we think is great. So that feeds into the increased student presentation. What we're also seeing though, sadly, is some of the tragedies that have happened in recent times around those students with obviously very poor mental health and who have sadly gone on to take their lives. Now, this is across the sector. We've seen a high media profile around this, and there's something for us to try and work together across the sector in terms of addressing the situations in terms of our students and understanding the devastation that goes along with this, and trying to make sure as best we can that that doesn't happen. Clearly, in terms of somebody who takes their life, the responsibility is with them, they've made that decision, but we need to try and work together to try and mitigate against any causal factors. We're seeing an increased emphasis on staff and students' wellbeing, and we're part of the Coventry and Warwickshire initiatives around wellbeing, because we recognise across the higher education sector that there's increased levels of burnout for university staff. And so alongside what we've seen in terms of student suicides, we've also seen in the press staff, academic staff, who've sadly gone on to take their lives in relation to the perception being it's about their workload. So what have we done here at Coventry? So like I say, the Faculty of Health and Life Sciences is leading the way. So there's been support and training for 11 staff to act as mental health first aid trainers within the university. So I lead the team. So we're all instructors around mental health first aid, and the majority of us are trained in all aspects of mental health first aid. We roll out the half-day mental health first aid awareness training to all our new pre-registration health students, as I said, before they go out into their first placement, to address the gap between the emphasis on physical first aid and physical health with mental health and mental health first aid. So we've trained a number of students, and we also train staff across the whole university group. So we've been down to London, we've been to Dagenham, we've been to Scarborough, in terms of staff being able to be trained in terms of the range of mental health first aid. So the training just doesn't stop on that day. So staff go away with a raft of resources for reading. But what we also are looking at here in the university is building on the skill base that we have in terms of the numbers of mental health first aiders. So those people that have undertaken the 2-day course, we've identified a number of those in each of the buildings across Coventry in particular, across our campus. And we, as from next week, we're launching all this on World Mental Health Day. As of next week, we will have mental health first aiders, as you do physical first aiders, in a number of our buildings across the Coventry campus, because we recognise that actually somebody in crisis, mental health crisis, they need somebody, they need that person to go to who can contain and to signpost and offer immediate help. So what difference has it made? Mental health first aid, we've been rolling it out for 4 years now. So what difference has it made? So As an example, so 6 months, January 2018 to July 2018, we trained 154 staff, and we've trained around about 500 staff since 2015-16. Now, if you think we have around about 5,000 staff as a group, we've roughly trained around 10% of our staff group, which we think is quite significant, really. And I think it demonstrates the commitment that the senior leadership team here at Coventry University has in relation to mental health and moving that forward as a positive agenda. We've trained around 3,200 students. So as you can see, we've been quite busy, really. So some quotes, something from one of the academics, a quote from one of the academics that we quite liked, because what we also do, we evaluate all our training. So this was one of the quotes. So the training made me think about my own and others' well-being. It made a difference to me as a practitioner and as an academic. I feel more confident to support students who are distressed. And then a quote from a student, the training has given me confidence to ask if someone is thinking of taking their life. So that's quite a key thing in relation to asking that question, because we always say, if you don't ask the question, you won't get the answer. And it's a challenge. People shy away from asking, are you thinking about taking your life? Because quite often they are scared for the answer that's going to come back. But what we're saying, by the numbers that we've trained in relation to mental health first aid, we have a whole raft of people now who are skilled in order to be able to contain that situation and to make sure that that person gets appropriate help. So mental health first aid, that we recognise, is not the panacea for everything. But what it has done, it's highlighted some of the other things that we've been looking at in relation to how we can take forward people's well-being, how we can help support people in terms of their mental health. So we started off with mental health first aid, but there's other things that have come along. So it supported staff being engaging with various wellbeing initiatives, so staff engaging with Alexander Technique training, the staff choir. So last year we had the Three Spires Barbershop Quartet came in and taught a number of our staff how to sing over a period of about a month, and then they did a lovely rendition in the reception of Richard Crossman building. We offer laughter yoga, staff mindfulness. We work really closely with the sports centre in terms of stretch and relax classes, and work with the sports centre in relation to other things that we can offer as wellbeing activities. We offer a weekly staff walk. At 12 o'clock on a Wednesday, you'll see a number of staff walking around the city. Half an hour, you can do a mile, 2,500 steps, and staff absolutely love it. Because the other thing that happens on that walk is around connectedness. So we connect with each other. You may connect with somebody you've never connected with previously, but what it does is a way of enhancing somebody's well-being. We also offer the Big White Wall, which is a confidential 24-hour online support system for staff and students. We've also got our toilet door campaigns on the back of all the toilet doors across all the campuses, London, Dagenham, Scarborough, Coventry. There are posters which indicate where staff and students can go for help. Because what we're realising is that actually we can have all these initiatives, but what we need to do is to make sure that people are aware and that they're accessible, so that it means that people doing whatever they do in the toilet, they can take a photo and use that in terms of being able to access. What all this has also done, has supported our mental health and wellbeing zone, which is a new initiative. Again, we're going to launch it next Thursday on the World Mental Health Day, and I'm going to talk to you a little bit more about that in a moment. So, has it made a difference? Do we think it's made a difference? Is it making a difference? We like to think it is. So I've said here it's reduced stigma. Well, actually, it's about reducing stigma. Stigma is a huge agenda. But what we're saying to people, it's okay not to be okay. Please do talk to us. So by talking and raising awareness, getting people to talk about mental ill health in everyday conversation, it is starting to reduce the stigma that goes along with that. What we have seen, I said at the very beginning, we've seen increased referrals to student welfare and mental health support. So it is making a difference. By raising awareness that it's okay not to be okay, people are starting to come forward for help. it's highlighted the importance of mental health within the university, and it helped build the business case for funding. So the new Mental Health and Wellbeing Zone, which we're, like I said, we're launching next Thursday, there has been a commitment from the senior leadership team here at the university in relation to that. So we've got an online platform, an online zone where staff can come and on students. There's a whole raft of resources on there for staff and students to be able to access. And there's also a booking system where our postgraduate research students, because we recognise those students have particular challenges and complex issues in relation to managing PhD studies, and they can come and book on for a 1 or 2 brief intervention with some of our clinical staff that are working in our new mental health zone, and receive support. So we're really pleased about that. So that's a quick run through really in terms of what we're doing here at Coventry University. So thank you for listening, and like I say, it's okay not to be okay.
Fantastic. Thank you, Diane. Just a question or two. Are there some of the initiatives you've been rolling out at the university that you feel would have a great deal of relevance in other workplaces as well, or when you speak to presumably colleagues and other folk who come in who do work in other areas, who would benefit from these as well, or people who bring their own new fresh ideas in that you're looking forward to implementing and seeing the positive impact those can have in Coventry?
Absolutely. So the basis for our wellbeing activities is the 5 ways to wellbeing, and in particular the weekly walk. We are advocating people to undertake walking meetings now across the university. So people are finding that the walking meetings are really beneficial, because what happens on a walking meeting, it's a little bit more informal, but you're getting exercise, you're still having your meeting, so the work is still being done. Because one of the challenges that folk have in the workplace is the time to do these things. So what we're trying to do is build in initiatives into the working day, so that people can get involved and can work together. So to start off with, improve people's well-being, but then obviously if there's challenges in relation to people's mental health, some of the initiatives, like I say, around the Mental Health and Wellbeing Zone, some of those can absolutely be rolled out across organisations. But putting in place, the 5 ways to wellbeing, but then also looking at how other organisations can engage with mental health first aid, right from whether it's the half day, the 1 day or the 2 day. Absolutely, once you've got a number of people trained in the organisation as mental health first aiders, we think that our work in relation to trying to address that gap between physical health and mental health, and our approach in terms of using the skills that we've invested in people to undertake and support their colleagues or students or whoever it is really, we think it's quite innovative, and it's really quite important, and there's no reason why other people can't build upon that.
Awesome. I'll see if I can get some walking meetings in for myself at work. Thank you again for your presentation today, Diane, and also a great big thank you to Claire Robson of Public Health England and Sean Russell of West Midlands Combined Authority for speaking earlier today. Before I close the webinar, I'd just like to thank Sylvia as well for setting up today's event, and also remind you all that you're able to find out more about the IHPE as well as joining now online at ihpe.org.uk/membership/how-to-join. Thank you again to everyone for joining us today, and please do get any follow-up questions you might have over to us, and we look forward to presenting to you again soon.